Today is World Suicide Prevention Day, and it takes on new importance in this time of COVID. Joining us today is Dr. John Santopietro. He is the physician-in-chief with Hartford Healthcare's Behavioral Network. Thank you for being with us.
Thank you for having me.
How has the pandemic affected suicide rates?
Well, and thank you for having me on World Suicide Prevention Day, because this is a day that we, gather our thoughts together and remember just how big a problem suicide is still in this country. We have, the last year we recorded in 2018, we had 48,000 suicides. And that number has been on the rise since 2000. So it is definitely a problem that we need to call attention to at least, once a year, really throughout the year. And it's a good question to ask, okay, it's already a problem. What's going on now that we're in the midst of this pandemic and actually really syndemic, because we have the infectious disease pandemic, we have financial crisis, and we have psychosocial upheaval. There really aren't any good numbers yet in terms of what's happening to the actual suicide rate that I've seen. But I can tell you that there are definitely indicators that there are increases in mental health problems,
Yes,
and substance use problems. And so we would expect the number to go up.
So, doctor, so many people who have been through this, it's just awful. And often they'll say, I wish I would have done something, or did I miss the signs? What's your message to people about looking for the signs of depression and how people can get help before it's too late?
It's a great point to really let people know there is help out there. I mean, certainly at Hartford Healthcare and the Behavioral Health Network, we are open for business. Our phones are open, our doors are open, as are the rest of the places in Connecticut. It's important for people to be aware of the signs of, let's just say, depression to start with, right? So, and everybody is stressed now, so you can't just go by that. So you look for major changes in behavior. So are people not going to work? Are they staying in bed? Are they sleeping too much? Are they not eating? Are they giving away things that are important to them? Are they talking about dying? And I just want to really get the point home that people should not be afraid to ask if somebody that they care about is thinking about hurting themselves. Many studies show that never increases the risk that somebody would act on that.
Right, better to ask and help someone get help. Doctor, thank you for being with us. I wish we had more time, but I want to let everyone know where they can go to get information on getting help. You can head to hhcbehavioralhealth.org. It's right there on your screen. Thank you.